Good morning. My name is Jill Marini. I'm the Director of Early Learning and School Age Programs for YWCA Hartford. I'm here this morning to talk about Project 26. Project 26 is a child care initiative that was made possible by a generous donation from the Dalio Foundation in collaboration with the Office of Early Childhood. The goal is to be providing childcare at 26 sites throughout the state of Connecticut for first responders and healthcare workers so that they're able to support the COVID-19 crisis in the state of Connecticut. Our YWCA Early Learning Growing Tree Early Learning Center is a site that's been fortunate enough to be part of the first wave of sites that have been set up. We are at 195 Garden Street in Hartford, close to St. Francis Medical Center and Hospital, and we are open to provide care for 26 children of healthcare workers at St. Francis. The way this works is OEC has provided me with the contact information for the Human Resource Department at St. Francis, and we have formed a partnership. They have made the information about childcare available to families. They reach out and contact me, and I kind of do a over the phone intake process. We talk about their children's health needs, and I describe what childcare during COVID-19 actually looks like. And then I send them the registration form, and I also reach out to the HR department to confirm their employment. Once their employment's been confirmed and they've completed the registration form and any required health documents, the child is then able to start. And how that works is they come to the center, and normally parents would come through the front door and take their child to the classroom, talk to the teacher, and drop the child off. During COVID-19, that looks a little bit differently. What happens is the children come into the front door with their parents. They enter one of our classrooms off the lobby where we do a health screening. We talk about their health condition. We ask some questions that the Office of Early Childhood and the Department of Public Health have recommended. We do a health screening, and we talk about we take their temperature, and we talk about how they're feeling and what's going on. Once we take their temperature, then a teacher comes from them back and escorts the child back to the classroom. This is a little bit different because normally a parent would drop the child off and get to talk to a teacher. What we've done to support families during this time is we have Hi Mama. It's a parent app, so we as soon as the parent registers, they're sent an invitation to join the app and download it. We use their email address to do this, and this app allows the teachers in the classroom to communicate directly with the families during the day, and the families to reciprocate and communicate with the classroom. The director and the staff over there have taken pictures and wrote short bios about themselves that are available in the screening room. They've been laminated so that we can sanitize them after parents leave. But it gives parents an opportunity to read a little bit about their children's teachers and have some type of connection to the kind of care that's happening in the classroom. Once the child goes back to the classroom, our ratios are much lower than they normally are. Our group sizes, I should say, are much lower than they normally are. We have 6 children under the age of 3. We have 10 preschool children, which is ages 3 to 5. And then we have 10 school-age program children. And they go back to the classrooms, and once they enter the classrooms, the first things they do is wash their hands. Each hand washing station has soap, towels, and the picture instructions to remind the children how to wash their hands. The classrooms have been set up a little bit differently. Normally in early childhood education, we like to see collaboration and children working in groups, which builds social skills and cognitive skills. However, what we've done in our classrooms is we've removed a lot of the chairs. So, for example, a table that might normally have 8 chairs at it, it's a rectangular, has 1 chair at each end now. That kind of sets the environment for children to naturally space themselves. The table that has 4 chairs normally may only have 1 chair, and the activities that are created are created to foster collaboration with distance. So the teachers work with the children to make sure that we're offering distance, and that can be challenging working with children because children naturally want that human contact. I can't speak enough about how important the funding and the donation by the Dalio Foundation has been. As families call me, I've had several moms in tears because they just were at the end of the ropes. They didn't know what they were going to do for childcare because so many centers have closed because attendance was down and it wasn't financially responsible to stay open. It's financially challenging not to stay open, but it wasn't financially responsible for many centers to stay open. So now we have children of, are under the age of 5 whose parents are potentially paying for a childcare spot to keep their spot at their original center, but now find themselves without childcare. And then we have school-age families who don't budget for full-day childcare in April and March. They budget for that during the summer. So to have that cost be incurred with no notice for them to be able to prepare and budget for it can be financially impactful to these families. So the fact that first that they're able to find a center that's open that will take care of their children, and second to have it paid for by the Dalio Foundation has had a huge impact on the work that they're now able to go and do when they go to the hospital. That's one less worry they have. I do have one family who having consistent, reliable childcare is part of their DCF plan. So us being able to provide that childcare has impacted them and has allowed them to be able to keep their child because they're meeting the requirements of their plan. Parents are so very grateful for everything that's being done for them during this time. And I think that it's important to them to know to go to work, that when they drop their children off, that people that are there want to be there. All of my staff are volunteers. They all volunteer to work, and we serve them breakfast, lunch, and snack. The donation from the Dalio family provides for snack and food and lunch. So we have food catered in for the children that follows all the childcare food program requirements, so that children are eating healthy meals, children are afforded the opportunity to take a nap and do whatever they need to do. We have opportunities for children who are in school age to do their homework and check into their Zoom classrooms and do what they need to do online. We spent some time yesterday setting up our hotspot and getting some computers up and running for them so that they can get the work done that they're required to get done for school. And that's not one more thing that parents have to do when they go home, but it's taken care of. We have a fun classroom. We have a work classroom where the children are doing their homework. They go in and do what they need to do, and when they're done, they can go to the fun classroom and enjoy the activities. I think it's very important that we discuss or we mention the sacrifice that childcare workers are making. We made the decision to close our centers because of safety reasons, but when this opportunity arose, we asked for volunteers to come in and work, and we have enough volunteers that were able to keep the center operational. And I have to say that the employees that volunteered are my top-notch employees. They're not, I have other ones, but the ones that have volunteered are top-notch, and they are really going above and beyond. Much like those people that are working on the front lines, they're making sacrifices potentially for their health to serve the community, because they believe that providing quality early childhood education and experiences is very important, especially during this time where children don't always understand what's going on. It's important to have some normalcy and some fun and some quality activities in their lives. So I think it's important that not only the YWCA childcare workers are recognized, but childcare workers across the state and country who are out there working the front lines. We hear about nurses and doctors and first responders, and rightfully so. I'm not taking anything away from them. We hear about, grocery store workers and those kind of workers, but I think we really need to discuss childcare workers who on a regular basis go above and beyond. But in this crisis, they're going above and beyond to care for the people who are caring for the sick in the state and in the country, and potentially exposing themselves to the virus by doing so. So I think that we really need to make sure that we mention their sacrifice. Overall, the program has been amazing. I think that families and employees of healthcare workers are very grateful for all that's being done to support them during this time. I think that this is probably an amazing project. No, not that probably, this is an amazing project that should be, some type of structure should be created to make sure that should this happen again, we have this all set up and we're ready to go. I'm grateful for this opportunity to be able to work with OEC and to provide care for these families.